Gout is an inflammatory disease in which monosodium urate crystal deposit into a joint making and it red, hot, tender, and swollen within hours. When this happens, it is called a gouty attack. The underlying cause is hyperuremia, too much uric acid in the blood with result. In the information of percept, needle leak crystal in arts with slow blood flow leak the joints and the kidney tubulus. Over time, repeated Gonti attack can cause destruction of the joint tissue with result in arthritis. To understand where the osteoarthritis come from, let's start with purines which together. With pyrimids are natural most common nitrogen-containing heterocycle. A heterocycle being any molecular ring or cycle with different types of atoms. Purines as well as pyrimidine are competition of nucleic acid like DNA and RNA, and when cells along with the nucleic acid in the cells are broken down to the body. Those purines are converted to uric acid, a molecule that can be filtered and extracted in the urine. Uric acid has limited solubility in body fluid stock. Hyperuremia occurs when level of uric acid exceeded the rate it is solubility about 6 mg per deciliter. At pathophysiology pH about 7 for uric acid lose a proton and become a urate ion which the bean sodium and from monosodium urate crystal. The trace crystal come from as a result of increased consumption of purines like from consuming purine-rich foods like shellfish, anchovies, red meat, or organ meat. Also, dog can result from increased production of purine, for example, high fructose corn syrup containing bifurcal contributes to the inflammation of urine by increasing purine synthesis. Another way crystal cut from is from discrete cleaner of uric acid when can result from dehydration from not drinking enough water or from consumption of alcohol beverage. But following uric acid to prepare out, regularly eating these kinds of foods can also lead to obesity and diabetes, both which are risk factor for arthritis gout. Hyperuremia can also develop as a result of chemotherapy of radio treatment since cell die at better than normal rate. Also, some individuals have a genetic predisposition to over production of uric acid, while others with chronic kidney disease may be unable to excrete the uric acid. Finally, there are some medications like thiazide, diuretic, and aspirin which can also increase the level of uric acid, therefore the rate of gout. Now, gout often directs the first metatarsal joint of the foot or the base to enrich its dose. This condition is called podagra. Specifically, in podagra, a person will wake up from sleep feeling on fire. Even the seat can be painful. The pain is most severe in the toes intermediately following the attacks and then general lynches over time, but the discomfort and swelling can last for the day or weeks. Gout can affect other joints as well, like those in the ankle, knee, wrist, and elbow. And this inflammation and local pains ultimately caused by the boost cell or leukocyte, which migrate to the site to have eliminated uric acid and release pan-promotory chemical including cytokine. Treatment of a gouty attack is typical focus on reducing the pain, often with steroid and inflammation medical or NSAIDs like ibuprofen or naproxen sodium, but occasionally with corticosteroid as well. Colical, which has anti-inflammatory effects by inhibiting white blood cell immigration, has also been used for a long time to treat growth attacks. To treat the underlying cause interest, uric acid talk, it's important to modify the diet doing this like staying well hydrated, recording or elimination soda, alcohol, red meat, and seafood as staying activity to ward off obesity. There are also medications that help to decrease uric acid level, which include cytidine oxidase inhibitor like allopurinol. Cytidine oxidase is an enzyme involved in the breakdown of purines. Inhibiting this enzyme result is less uric acid production. Urinostic medication like probenecid incite excretion of uric acid by the kidneys. Over time, repeated gouty attacks can develop into chronic gout, which type arthritis with a joint tissue discrete and permanent joint deformity. Chronic gout can eventually lead to permanent deposit of uric crystal, which form along the bone just beneath the skin. Individuals with chronic gout are also at an increased risk made of uric acid, as well as uric neuropathy, which is with uric instream of the kidney. Okay, thank you for watching and see you next time. Wassalamualaikum warahmatullahi wabarakatuh.